you will just tell us your name and what your title is and how long you've been here.
I'm Nicole Wenger, and my title is Child Life Specialist, and I have been here for almost 3 years now, and I've been a Child Life Specialist for almost 5 years.
And tell us a little bit about your background that got you to where you are. College, what you studied, maybe any special certificates or training?
Yeah, absolutely. So my undergraduate degree is in Human Services and Early Childhood Development. So a lot of background in human development and child development. And then my master's degree is in child life and family-centered care. So specifically trained to help provide support and resources for families and children going through hospitalizations and trauma. So.
And now, what's a typical day like or a typical week like for you? How many patients do you see? What do you encounter?
Yeah, so I am the Child Life Specialist. We have Child Life Specialists in the hospital in all different units and areas. I specifically cover our inpatient areas, specifically second floor. So that is our hematology and oncology inpatient area. And then right now, 2 West is our inpatient surgery area. So I have, let's see, right now, on those 2 floors, I have a total of 39 patients today, and I go around on a daily basis and kind of assess needs with the nurses and the doctors and the staff and the parents to provide support and just making the hospital a little bit easier to experience for the kids. And that may look like a lot of different things, whether that is preparing kids for procedures or tests that they might have, maybe educating them about those procedures or tests, providing toys to play with, developmentally appropriate activities so that they can experience normal things and things that they're used to in an environment that can be scary and intimidating. So to provide that normalcy and that comfort in that time, and provide family support too, because it's hard for the mamas and daddies and families too when it's their kiddos going through a hard time. So, yeah.
What do you like most about your job?
I love my job so much. I think it is the best job in the world, and I really love that I get to come alongside kids and families in a really difficult time when they are experiencing, whether it be pain or a new diagnosis or trying to figure out what's going on or just really sick for a little while. I really enjoy the fact that I get to come into an experience and help a child still get to be a child, and still get to play and have fun. Because even when kiddos are sick, they still want to play. That's their priority, and it should be. It's how they make sense of the world. It's how they interact with everybody. It's how they learn. So to provide play in a hospital setting and be able to bring a little bit of sunshine into sometimes a dark time in a child and a family's life is really, it's an honor for me to be able to do that kind of work. So that's definitely my favorite thing. So
now, without breaking any confidentiality rules, can you think of any meaningful moments or things that kind of stick out to you that you've been involved in?
Yeah, so some of my favorite things are just getting to maybe plan special experiences for kiddos, for patients, if they're having a hard time, maybe planning a special party for them that's going to make a day that's maybe hard special. So we had a patient who was very, very anxious about shaving her head after she had started chemotherapy and her hair started falling out. She became really upset and anxious about the idea of losing her hair and then eventually shaving it off. So Mom had talked to the doctors and consulted with social work and myself, and we came up with the idea of throwing her a party for it and talking to her about it and saying, well, what would make this experience easier for you? And she talked about, she loves JoJo. So JoJo is the singer and dancer. He has the big bow line. And so she loved JoJo. So we did a JoJo hair a go-go party and planned big sparkly pink bow activities for her and her friends. And a few of her friends from school got to come and spend the afternoon with her and doing crafts and taking little goodie bags home. And it just made something that was a really hard experience a good memory that she got to look back on, instead of something that was maybe going to be dark or traumatic. It provided a little bit of normalcy and fun in that moment. So that was a really fun experience.
What advice would you give to somebody who wants to do what you do, Nicole?
Yeah, if you feel like child life is a field that you are interested in or want to pursue more, I would give the advice of there's a lot of steps to get to being a child life specialist, and it's a lot of specific training, but I think the first step would be going to the Association of Child Life Professionals website and kind of looking at all the ideas and requirements to do that, and then also look at volunteering at a children's hospital or a hospital that has a child life program, and seeing if you can volunteer in a setting with a child life specialist to get a closer look at what we do on a daily basis. And that will help you maybe get an idea of solidifying if that's a career that you want to go into. And most programs, internships and practicums that are for child life like you to have an experience of volunteering in a child life program before even starting the education piece of it. So that's definitely a good place to start.
Last question or statement. We didn't get to have our teens here this summer because of COVID. Any words of encouragement, anything you'd like to say to them to end up?
I'm so sorry that it's a crazy world right now, and this kind of jumbled things up, and we aren't able to have you here in person. We absolutely love having you guys here. You bring such sunshine to the summer, and being able to see you guys here and doing activities with the kids and experiencing the hospital in different ways. I really love seeing that, and so I'm really sorry that you couldn't experience that this summer, but I would just encourage you to keep going and keep moving forward and using opportunities like this to learn and grow, and just thank you for being interested and willing to learn and grow. And we appreciate you so much, and even just your willingness to be a part of this process. So
thank you.